Hello, good morning, good afternoon, and good evening, wherever you are. Welcome to our discussion today. Thank you for being here and joining us for this very important panel on global health research ethics. My name is Shailey Prasad, and I'm the Executive Director for the Center for Global Health and Social Responsibility here at the University of Minnesota. Before I go any further, I want to thank the University of Minnesota's Research and Innovation Office for hosting Research Ethics Week, which this presentation is a part of. Our conversation today is global health research ethics, practical approaches to navigating international power dynamics. Now, this is a topic that's very important to our center. Our center, the Center for Global Health and Social Responsibility, has been around since 2010. And since our inception, we've focused on not only creating excellent global health education, research, and training opportunities, but also ensuring these opportunities are grounded in equity. The field of global health is often criticized for being extremely westernized. Too often, US researchers have the resources required for projects and therefore dictate the work that's done. Now, a mentor of mine indicated that ethics are paradigms that reasonable people can disagree with. Now, that's challenging, isn't it? The essence then is that as far as ethics is concerned, we need to continuously engage with it, wrestle with the challenges, and be open to alternative perspectives. We also feel we need more practical, grounding suggestions for approach towards ethical topics. To this end, we should be thinking about equitable approaches from budgets to authorship to data sharing. Our discussion today will be focusing on these issues. We will set aside some time for question and answers at the end of this event, but feel free to submit your question in the Q&A function during the presentation. I just want to let everybody know that this webinar is being recorded and will be available on our website soon. Today, we have three amazing panelists. I'm thrilled to be joined today by Dr. Mahsa Abbasi, Dr. Kumi Smith, and Dr. Irina Stepanov. Dr. Mahsa Abbasi is an associate professor in the Division of Infectious Disease and International Medicine at the Medical School here at the University of Minnesota. Her clinical and research interests focus on HIV-associated opportunistic infections, particularly cryptococcal and tuberculous meningitis. Her work explores neurological complications, antifungal treatment strategies, and host immune responses. For the past 8 years, she has partnered with research teams in Uganda, where she also lived for several years. Dr. Abbasi, thank you for being with us today.
Thank you very much. I'm very excited to be on this webinar today.
Wonderful. Next, we have Dr. Kumi Smith. Dr. Smith is an associate professor in the Division of Epidemiology and Community Health at the School of Public Health here at the University of Minnesota. She studies health disparities at the intersection of infectious disease, substance use, and unstable housing. Dr. Smith also develops structural interventions to better support clinical workers in providing culturally specific and trauma-informed care for marginalized patients. Much of her international work is based in China, where she has lived and worked for several years. Dr. Smith, thank you for being with us today.
Thanks for having me.
Next, we have Dr. Irina Stepanov. Dr. Stepanov is the Distinguished McKnight University Professor and Mayo Professor in Public Health in the School of Public Health's Division of Environmental Health Sciences. She is also the director of the Institute on Global Cancer Prevention Research at the Masonic Cancer Center. In her research program, Dr. Stepanov applies the fundamental concepts of science and analytical technologies to incorporate biochemical measurements, such as biomarkers of exposure, harm, and susceptibility to disease, and applies this in a wide variety of areas. Her primary research focus is on tobacco carcinogenesis and the mechanisms of underlying inter-individual differences in cancer risk due to tobacco use. Dr. Stepanov collaborates with research teams in India, in China, and Thailand. Dr. Stepanov, thank you for joining us.
Thank you. Glad to be here.
Now, with that, I'd like us to jump into our questions. I'd like to get us started by asking each of you about your experiences in global health research. And in particular, I'd like to know what is the single biggest cultural difference you have navigated in your research projects? Dr. Abbasi, over to you.
Thank you. In thinking about this question, I thought a lot about when I first started out in global health research, which was a while ago, a long time ago in 2004. One of my very early experiences as a pre-medical student traveling to Uganda to work with, to Kenya to work with an NGO. It was at this time, there was three of us traveling to Kenya. We were going to be working at a rural medical clinic. And the women who were running this medical clinic asked us if we could assist them in conducting a needs assessment survey so that they could communicate with their foreign donors on what the priorities of the clinic were, because they thought that the foreign donors had different priorities and were funding things that the community did not essentially need at that time. Now, being 24 years old, I wasn't really able to take in all of the nuances of that experience with power dynamics and who has the money, and the money makes all of the decisions, and the people doing the work on the ground feel disempowered to make the decisions that are best for the community. Well, so we did the needs assessment survey, and of course, what we found is that their needs were exactly what they felt the donor money should be providing providing care for the community, and the fact that they needed other foreign persons to come in and write that and communicate that to their donors. So that experience stuck with me for a very long time, and I've been able to reflect on that experience throughout my years in research. And as Dr. Prasad said, with my last 10 years working on the ground and remotely in Uganda, I've reflected on that and thought a lot about the hierarchy of decision making in global health, and try to, as best as I can, and learning as I go, and especially as a junior researcher into faculty, kind of thinking about when the decisions are made, who is making the decisions, who feels empowered to make the decisions, who's speaking up, who's not speaking up, and who's missing from the conversation, and really trying to kind of go through all of my interactions like that, to hopefully not put anyone in that position of feeling so disempowered that they can't speak up in terms of like what the actual needs are. So.
Thank you, Dr. Abbasi. I think it's interesting you bring up the point about privilege too, but I like how you shaped it, that you sort of lean into their privilege rather than feel trapped or paralyzed by the privilege. So I appreciate that. Dr. Smith, over to you. I know you've spent time living in another country, in China. What's your experience been as far as the cultural difference is concerned, either there or elsewhere?
Yeah, the cultural differences I tend to think of really when it's in the research context is the culture of bureaucracy. China's, economy, you could argue, is not necessarily communist, but the trappings of government infrastructure and bureaucracy still really do like carry the legacy of old school communism. So I think when doing research in China, it's not really necessarily just about the scientific question and getting the best data and the best scientific collaborations. I've had to learn a ton about understanding like the institutional structures and priorities, history, individual pressures, things like that are very, very much a part of my regular work there. And I think one example of how that manifests in the way I navigate relationships there is that you have to get really kind of close with people on an individual level, because you can't just understand relationships and dynamics through people's titles or their roles. You have to understand their histories and their relationships with other individuals, which they're happy to talk about, but you do have to take the time to get to know them and to ask those questions and to have that curiosity. And there's also a lot of humility that I've had to learn in the fact that I am not part of that hierarchy. I'm not part of that bureaucracy. So, for example, if I travel to China to, check in with my partners, many of whom are in government, I have learned not to make like long-term plans. I can't say, hey, I'm coming in April, let's pencil me in for a meeting. I have to understand that you can pencil someone in, but if some kind of local priority takes precedent, or if someone higher up, one of their directors shows up, everything does get dropped, and they have to attend to those meetings and to those priorities, of which I'm not a part. So I've had to sort of learn to operate with a lot of flexibility and sensitivity as to where I sort of fit into these dynamics, and to be mindful of it, but also to work really sort of flexibly with those. Yeah, so those are some initial thoughts.
Wonderful. Um, Dr. Stepnov, your experience is a little different. You've come originally from a different country and you work in multiple countries. So your experience is probably amplified a little more. Can you tell us a little bit about the cultural challenges you've had in each context, in some of these contexts at least?
Yes, I am also thinking about my identity as a basic science, so I tend to focus on practical implementation of projects and nitty-gritty of the scientific approach. And each place where I collaborated has its unique strengths and opportunities, and each presents a unique cultural difference. But that one general challenge that comes to mind is the differences in expectations regarding the nuances of the research process and its implementation. One example is our collaboration in China with Guangxi CDC, where we encountered an unexpected challenge when we discovered that our partners felt obligated and actually promised to communicate results of our carcinogen exposure testing to study participants. And this is something that is generally expected in their research activities, but we did not know it in advance. And we usually avoid doing this in our studies here in the US to prevent the potential misinterpretation of the non-clinical research data. So we ended up navigating this challenge by developing a creative communication format that addressed our partners' needs, but also allowed us to do it in a way that did not raise concerns and actually ended up an innovative approach to communication. And another example is our partnership with Tata Memorial Center in India, in Mumbai, where we had an NIH grant funded. And our colleagues felt that a study startup meeting was not necessarily needed because study description in the grant proposal was sufficiently clear, and we could simply reproduce a protocol that has been implemented elsewhere. However, during the startup meeting that actually happened at the beginning of our project, we kept discovering more and more aspects that needed to be adapted to the local environment and culture. We ended up spending 7 hours in that meeting instead of the planned 2. And at the end, our collaborators wanted to go back to question number 1 on the agenda because they felt that it needed a little bit more discussion. So taking time to understand the expectation throughout the whole life cycle of project and any unique expectations is really important so you can develop best practices collaboratively.
Thank you for that. I really appreciate the answers all three of you have put in there. One of the cornerstones of a lot of the ethical frameworks is the principle of equity. Now, that's a very broad categorization, isn't it? Equity is, we hope we're all always engaged in equitable things. What's been one practical approach towards building equitable studies with international partners? Is there an example you can come up with of a challenge of working with international partners as far as equity is concerned? And if you have a strategy in overcoming that challenge, and Dr. Smith, I'm going to reach out to you for this.
Sure. I think one interesting one that I think all of us were talking about recently is around language. is a really powerful shaper of the dynamic. Because if you're coming in as the Western scientist, you're probably fluent enough in English that you've been now publishing and establishing a track record in English, which is the language of science, of international science. And so just by being someone who can leave, a publication record in English and get things published, you now introduce a power imbalance in that, partnership community. But it's really interesting to note too that there's a lot of dynamics even within the institutions that you'll engage with. People have noted that there's generational differences. Often, like younger investigators might be have higher English language capabilities than their older senior colleagues. There's other dynamics just in terms of, class and access to education. Community partners might have a much tougher time breaking in and having relationships with Western colleagues. So I think being really sensitive to who is in the room, who's not in the room, and then also who can understand what's going on, I think is really important. Two practical things that I've kind of figured out is and I'd be curious to hear what others think, is that a great way to establish an early partnership with international teams is not to come in guns blazing and trying to apply for a really high stakes grant, but rather to co-author a paper together is a really great sort of technique. But in so doing, you have to make sure that both partners who are going to collaborate on this know their roles and that they have the time to learn from each other. So this was a huge part of my training. I was like the junior scientist who was paired up with, a local Chinese, maybe also junior scientist. And we passed back multiple drafts back and forth with each other. We had a lot of in-person sit-down meetings to talk through these drafts. And the hope of what that kind of well done format can present is it's a two-way learning street. I get to learn about the science and about the data and about their research, and they hopefully are picking up on some writing tips along the way. But this worked best because I was based in China and I was living there, so I could come in day in, day out. Another tip has been to kind of create and host and organize writing workshops for internationally based colleagues. We've seen a lot of success with this with the team that I work with in China, and the local scholars really appreciate that because it gives them some modicum of independence. I'll say one last thing about language for me, which is that I've been studying Chinese since my undergrad years, but I always joke that I can really only speak about epidemiology and order food and haggle at the market. So there's a lot of conversations where I seem like I can speak Chinese, but I will miss a whole lot. So if you're going to acquire language fluency, I do think it's worth sort of communicating with your partners and being really transparent about how much you can understand. And sometimes, in fact, having interpretation enter the equation slows things down and really checks everybody's comprehension along the way. So I think learning the local language is, to me, not that's not like a paradigm rule that everybody must stick to. Obviously, you should show interest and curiosity about the local language, but if you're going to go and acquire it, be really mindful of how that's going to play into those dynamics moving forward too. So those are my thoughts on language equity.
Thank you. I mean, I think this is a core topic of discussion in various spots, right? The hegemony of English being the most accepted language, which has its own challenges. So thank you for that. Dr. Stepanov, over to you.
Of course, we always strive to engage in research that matches the interests and the expertise of our partners, but also addresses local public health needs. Sometimes you have one or the other, but once you have that perfect combination, you need to think, again, I'm thinking about practical elements, some of which Dr. Smith touched up on, such as equitable contribution to study design, equitable budgeting, embedding sustainable capacity building, and also strategic efforts to ensure a balanced and equitable stage sharing in publication efforts and other dissemination activities. One challenge I'm thinking about is the particularly sustainable capacity building, because often local resources are limited and sometimes you experience a turnover of the trained research staff because they find opportunities for applying their newly developed skills in some other settings. We had it happening in India and in China, where we had to retrain staff in very unique research skills that we wanted were essential to implementing our project. So generally what worked best for us was being strategic about advertising our research efforts to the local institutional leadership and also engaging with the local media, of course, through our partners to elevate the profile of our research efforts and the benefits that it brings to local communities. And we have also been really successful in having local research team members enrolling in graduate programs while working on our collaborative studies, which serves as a retention of the skill, but also motivates them to develop careers in this field. So we are really proud of whole generation of young investigators who stayed in the country, in the field, and continuously, building additional capacity. And thinking of publication, just last thought is that we also discuss publication authorship in advance. We usually lean towards having local researcher as the first author and then sharing senior authorship with our main international partner. And that helps us to kind of ensure that research comes from within the country, authored by local researchers, which usually has much deeper impact of what we are trying to accomplish.
Thank you, Dr. Stepanov. Before I go to Dr. Abbasi, I just want to remind the audience that if you have any questions, please put that in the Q&A section. I see a question already there. We'll come to that as soon as we are done with our preliminary deliberations. Dr. Abbasi, over to you.
Thank you. So I just wanted to, I have similar thoughts to what's already been mentioned, but we at the University of Minnesota, our meningitis research group, we've been in partnership with the Infectious Diseases Institute in Uganda for 20 years now. And that partnership has really tried to build on training the future researchers, both in Minnesota and in Uganda. And part of that is kind of in terms of equity is thinking about who's writing the grants, who are the PIs and the co-Is on the grants, and who is getting opportunity to be in those positions. But we also look at some of the younger medical officers and junior researchers who are coming and kind of look to see, since they're working with the team, what are areas of skill sets that need to be developed for them to become independent researchers on their own. And that has, again, led us to what's already been mentioned. We do writing workshops, we do training workshops where we do talk about how to write manuscripts, how to write grants, clinical trials training, laboratory procedure training that may not be there at that time. So we try to identify what individuals' skill sets need to be built up so that they could kind of go ahead, whether in their further medical training or their PhD programs, or kind of becoming their own independent researcher. So some of that, I think, has already been said, but that is, I think, one of the main ways in terms of capacity building to ensure that there's equity amongst all the levels of researchers and team members within our group.
Dr. Abbasi, what you mentioned really resonates with me, because I think when you started with the premise that we've been working there for 20 years, that itself is such a powerful narrative, isn't it? It's that long-term partnered work, which inherently is built on relationships, personal relationships, connections, treating each other as colleagues and friends and family in some ways, right? So that's a very critical point, and I appreciate that. And there is also the framework on what you mentioned and what Dr. Stepanov mentioned goes from capacity building to capacity strengthening, because we learn in this process too. So I appreciate that framework that you bring. Now let's go to the next question. This is, I'm sure, will excite you all. What's your approach in creating a budget that meets the needs of international research team and sometimes some of the onerous requirements that we have within our own institution? So do you have, I'm sure this is not a one-liner, but do you have an approach you take when you're looking at budgets? And Dr. Stepanov, I'm going to get you started with us with this question.
Yeah, I'll try to come up with a one-liner. We have our partners develop the budget after we have a shared idea of what we want to accomplish. And we also make sure that a significant portion of the budget is spent locally. So even if it is not required by the funding mechanism, we are thinking close to 50-50 with some deviations depending on the type of the research. And this can be facilitated by thinking strategically about doing as much as possible locally at our partners' side and leveraging their resources and their expertise. And of course, thinking about building capacity is contributing to enhancing local capacity is also a way to ensure equitable budget, because you can, budget for things that help to strengthen that capacity. So that's my very brief answer.
Thank you, Dr. Stepanov. Dr. Abbasi.
Yeah, I will just, I guess, start by saying that I don't really have any great answers to that. And I'm, just as I'm learning, myself to writing these budgets for these clinical trials, a couple things that I was thinking in sharing is, you know, uh, being able to provide enough support for the local investigators, whereas we may oftentimes give ourselves quite a bit of clinical effort and salary support and put much less on the local budget because salaries are inherently unequal, and then asking them to do much more than what they're compensated. So adequately making sure we're compensating at the best rate that we can their salary support. Trying to build in kind of infrastructure training into the budget so that if we're buying equipment, we're ensuring that the equipment is maintained over years and that there's training so we don't just buy equipment and leave it there and it's never used again. And then also administrative capacity, being able to ask our local partners what type of administrative, auditing, and grant management support that they need so that they're able to kind of continue functioning as well. And then, yeah, just making sure that travel is adequate for both partners so that, I'm not always traveling internationally, but then, people are also able to travel internationally for conferences and present the work as well. So just trying to build that into the budget, as best as we can with the changing, I think, NIH environment as well, and kind of thinking about how to make that still, how to continue building that equity as we go forward.
Yeah, it's interesting because it's always a challenge to look at it from an equal viewpoint as opposed to an equitable viewpoint, isn't it? And what always struck me is when we have partners in other countries, a lot of the work they're doing, for example, in the research space, is in addition to what they're doing. So when we bring up terms about protected time, I've had people laugh at it. I'm like, what do you mean protected time? Nothing is protected for me. I have to do my day job and do this on top of it. So it's fascinating. Dr. Smith, how about you?
I was actually going to make that same point that you just brought up, Shailey, which is the structural barriers to sort of pay equity, which is I work with partners whose jobs don't allow for effort coverage from external grant sources. So if I'm wanting to write them into the grant, for grantsmanship, I need to demonstrate that they're involved and committed to this project. But for, legal domestic reasons, I can't write in their effort. So we've had to come up with really creative solutions. A lot of bureaucracy, again, talking to their bosses and trying to secure, letters that demonstrate that these folks are willing to work on these projects, and yet that it won't somehow impede on their daily work. One solution we've come up with this is to not just write on paper, don't worry, funders, it's fine, but instead to actually set up like a grant slush fund so that the money that would have gone to their salary could go instead to like a pot of sort of discretionary grant money that the local team can use for their own research. Because I think salary is one thing that's, I think, an inequity that we can't necessarily solve in the context of a grant budget, but there are, I think, some solutions that we can come up with for, allocating money that you can use in the workplace to get your job done. And that's a different sort of freedom that you can at least grant your partners. And I will say to your point, Shailey, it's important to be really mindful too that it's easy to think of pay equity in terms of like the US based folks versus the people in the foreign site or foreign to us. But even, within these locations and settings, the folks who work as consultants for an international nonprofit versus those who work for a government agency, the pay inequities among them are also really like garish. So I think it's really important to pay attention to those. I've always found that transparency and kind of getting in front of the problem and acknowledging these things has worked best. But I do think grants are really interesting, even among American investigators working together. It's going to bring up stuff about how much money you all make, and I think it's actually healthy. But it's like you should put it front and center in your international collaborations too.
Yeah, Kumi, I think I appreciate you bringing that up because I think we won't have a very clear answer, right? It's not like we will magically make pay equity happen in another country. We know that the presence of an international agency, whatever it is, an NGO, a research project, or anything like that, significantly disrupts the economy, local economy. And that becomes an essential challenge for the long term sustainability of ongoing work. So I appreciate you bringing that up. But I also acknowledge the point about being very transparent about it upfront rather than trying to hide things. So appreciate that. We will now go to questions, but before we go to the Q&A section, we have a very brief commercial break. Jake, this is a quick announcement that our Global Health Seed grants, these are meant to catalyze larger research studies. This is in the field of research. These are grants that are available through our Center for Global Health and Social Responsibility. A criteria is that we need to have a University of Minnesota faculty member partnering with a co-PI anywhere else in the world. And these are specifically for research studies. So it gets a lot of scrutiny. We send it for external review. RFP for these are open this Friday, March 6th. I would also strongly encourage you folks to subscribe to our newsletter. A link to the newsletter is put in there, or visit our website. It has all the details. You will have more opportunities to engage with us and with some fabulous researchers here at the University of Minnesota. And that was a commercial break. Thank you for that, Jake. Now, let's go to the questions that have come up in the Q&A. Again, I encourage our audience to put in more questions. The first question is a really deep one. It's asking almost a challenging question about what specific contributions do US researchers bring that might not already be present among scholars working within the community? Kumi, do you want to take a crack at this?
I mean, I think there's two levels to that question, and I think one is what do, people in the US bring? And I don't know that there's anything inherently that being American brings you. I think just the more diverse voices at a table, regardless of where the research is taking place, can be really, really profound. We all come from different we have different norms, backgrounds, cultural insights that really can enrich like research endeavors. I think there is something undeniable, though, about if you're trained in sort of a US-based program, you are inevitably inundated with training around getting NIH funding. And I know we're in a different environment with that right now. But that has always been sort of the gold standard of sort of scientific achievement globally. So if you have that training, that experience, that exposure to mentors with long NIH funding track records, you do inevitably bring something to the table in terms of that access and those knowledge about grantsmanship, secret handshakes, knowing what these different study sections mean. That I think is your capital. And I think being generous with it and being aware of it is one way to navigate that kind of gap.
I appreciate you mentioning it's more along the systemic logistics side, not necessarily the intellectual capital that you're talking about. Others, any additions to what Kumi mentioned?
No,
Masa, over to you.
yeah, no, I don't have. I will just say that, yeah, I think, again, how our research collaboration initially started was, we just had a researcher from the University of Minnesota go out to Uganda and talk with a researcher there, and they formed, a research question together, a hypothesis, and that sparked a, decades long collaboration. So not necessarily that there was not, specific skill sets of already available. But I think I did mention that we do actually, and we do try and kind of, because not everyone will have every skill set. So we do try to always, ask what are some limitations, what are some skill sets that aren't there, and then try and training those skill sets so that we are also doing capacity building while we do research. So, yeah.
Mas, I like the sentiment behind that. It's the premise of learning from and with each other. That is, I think, the core of what global health should be, right? So thank you for that. I have the next question is, what do you do if there are technical limitations in certain communities? Irina, I know you've had the experience of working across multiple sites and setting up fabulous laboratory capacity. How
Yes,
do you go about?
yeah, I'm thinking about this as an opportunity to be creative, to actually find solutions to do research in a way that it's less expensive.
Mhm.
And you can actually, again, learn from doing research in resource limited settings really efficiently, really creatively, and even inform research in your own backyard in the US, working with communities where resources might be limited. We had experience where we had to find very specific laboratory capacity, and we just went ahead and did environmental scan, trying to facilitate or identify partnerships that our local collaborators could engage in order to be able to achieve the goals that they wanted to achieve through this collaboration with us. So these are my thoughts.
I like the framing of it as a creative solution, isn't it? Like you figure out newer ways of doing things, both locally in another country or back home here. So thank you. Other thoughts?
I guess
Masa?
again, that's, I think that's where partnership really comes into play, having, partners in different institutions and collaborators is that, they're able to bring some of that technical expertise. We do have one, a neurologist in Uganda who's been doing a lot of work, and in a field that it's not really diagnostically that's not really available locally, and over the years has been partnering with the different institutions in Minnesota as well as California, kind of looking, using samples and running those samples in their labs, but then at the same time, with thinking about how can we ultimately bring this and strengthen laboratory capacity in Uganda so that we're able to do this locally. So that's been something that he's been working on for many years, and little by little it's going to get there. So that's what the long-term kind of commitment to each other also helps too, is to look at some areas where that technical capability is not there, and then kind of thinking about how can we strengthen that as well.
Yeah, I like the framing that you can't always just duplicate what's happening here, right? We can't just create, okay, this is how we are doing, no other way to do it, just do it this way, but actually being a little more creative in that conversation. So appreciate that. One of the areas that I sometimes elicit a groan amongst multiple global health researchers is about IRB, navigating IRB processes. So I would like to hear from you folks. How do you navigate that, particularly when you have to do IRB clearance here in the US and in another country too? Kumi, any insights, any hilarious or otherwise experiences in this?
I don't know how funny they are to other folks, but yeah, I have a lot of stories. I mean, I will just say that for anyone who's like going into global health, find other people in global health to like complain to about this, because you'll be so you'll feel so isolated when IRBs come back to you with like requests for revision and all these things. It comes sort of almost in this it's easy to interpret those as that your practices are somehow not ethical or you are somehow like suboptimal. And I think it's much more about trying to align different systems who were never designed to really work together. And so I think a lot of the challenge is just that both sides will very much sort of rely on the other. So my Chinese IRB will say, we don't have an opinion on that. We're waiting to hear what the Minnesota IRB will say, and the Minnesota IRB will say the same thing, and now you're sort of caught in the middle. So that's hilarious. But I would say too, there's just a lot of times too that the stringent levels of privacy and protections that we sort of really expect groups globally to work with always need to take local context into account. So I have a story from my earliest days working in China. We were working with women who sell sex and who inject drugs. So it's a very, very vulnerable population. And I was part of a team that was overseeing survey administration in this population. IRB rules dictated, and we had funders from the US along for the ride who were, very concerned that when surveys of these female sex workers were being administered, that in fact they were being done in relatively public places where others could see and hear what was going on. When they tried to amend that situation, though, the compliance would dictate that those women would have to be in a isolated room with a stranger and a door closed. That's not safe for them. They do not like that. They do not feel safe. So the solution we came up with was to, identify a bench outside these rooms where they could be in eyesight of their, like coworkers and people that they knew, but out of earshot. So this is not something that you can necessarily write into an IRB protocol. It's hard to describe what are you going to define as out of earshot. But these were the practical solutions we had to come up with because anyone could see that our practices were causing distress. And these are sort of IRB dictated, policies. So there's lots of ways like that in which I don't know if I would define it strictly as cultural. I just think that there's hyper local context that always plays into how these things, how research gets implemented. And so that was a classic case of, watching sort of Western researchers be sort of a little bit humbled by what they didn't know. And I was one of those.
Thank you, Kumi. Irina or Masa, go ahead, Irina.
Yeah, I can add. just I agree with everything Kumi said, and just from practical navigation point of view, where do you start? I think it is unfair to impose from the start expectations of our IRB, in how study needs to be done. So we usually start with our partners applying for their institutional IRB because it needs to meet local expectations first. And once that is approved, then we go to our IRB. And before even we go to our IRB, we try to discuss, what may need to be added to the protocol or consent form, something that our partners would be comfortable with, that does not really violate local norms or expectations, but we know that our IRB will require that. So we get to that point, then we have IRB, local IRB approving protocol, then we move to University of Minnesota IRB. And sometimes it results in a little bit back and forth, but usually it works pretty well in this sequence.
Thank you. Appreciate that. It's one of those things that is almost like a power struggle, isn't it? Whose IRB takes precedent, and it's one of the tough structural issues that need to be always addressed. And I don't think there is a very easy way to go around it, but each individual case we need to address it. But I like your approach of paying credence to the local IRB first as a practical way of doing this. Next question is from Dr. Nardos. As researchers, we often struggle to translate our findings into real-world solutions once the work is published. Can you give examples of how findings from your research has helped change either clinical practice or policy or community awareness in the local community?
A quick
Kumi?
example, yeah.
Yes.
We have a really great experience of having local practitioners get excited about a method we introduced, and they're actually so quick to try to adopt it that we had to ask them to wait till the clinical trial's over. But yeah, Rahel, I hear you. It feels like a rare opportunity to see your results make an impact. In our case, our technique is that we've been sending in standardized patients, actors, to essentially audit the healthcare system and see, how care quality differs if you say you have HIV versus if you say you don't, for example. We happen to be partnering with a local physician who runs the clinical care quality network in the entire province that we work in. And he's always been desperate to find a feasible, cheap, reliable way to measure care quality. And when he saw that the standardized patient approach can actually be done, he's been really excited to try to implement it sort of, like ahead of any trial results. So it's been really fun to both ask him to pump the brakes, but also to think expansively with him about where it can go. That is a rare exception, though, to a lot of studies that I feel like I've been involved in where the results are rather incremental. So I'd be curious to hear others' experiences too.
Yeah. Thank you for that.
Yeah, we publish a lot. We go to a lot of conferences, many conferences throughout the year to present our findings. We, try to participate on guidelines, both internationally and domestically, and to get our findings disseminated. So we do a lot of spreading that information once we've generated it.
Yeah. Thank you. I think it's an important part to keep your presence in those spaces for the dissemination. So you look at practical application of that. The next question is an interesting one. When you look at international research grants, are there green flags that you look for in a grant proposal, or probably more importantly, are there red flags that you commonly see when you look at a proposal? When you look at an RFP, do you get like, oh no, this cannot happen? Let's start with the red flags and maybe the green flags too.
You could start with maybe it's like an orange flag is just if there's someone who has a really strong track record of research in a very specific area and it's simply just being replicated in a new location,
Yeah.
sort of suggests like opportunism a little bit. Not that those are always like super dangerous or bad or inequitable, but that's something where I think I would look for a hopeful sign that there's more like local input. A green flag is, and not to say that this is the only that we all must acquire this, but if someone ever shares, an investigator shares something personal, like that they've spent time in a country or that they speak the language or something, that's always really exciting to see. So if that's something that you bring to the table, I think I've been actually told this by program officers is, I wish you had said that in your grant application that you actually know this place. So I think you should never hesitate to put that in. That would be a green flag that you could use.
Other thoughts, Irina?
Yeah, I would definitely say that as a green flag, having evidence that you collaborated, that you have an established relationship with the research team that you propose to do research with is really important. It speaks to feasibility. If you just say, hey, we never worked together, but we have a great idea and we'll make it happen. Any challenge that you experience in carrying out research here in US, multiply it by 10, trying to accomplish that amount of work in time constraints that a grant represents. So feasibility is usually supported by showing that you already have done something. Yeah, so that probably would be my green flag. In terms of red flags or orange flags, would be if there is no developing, enhancing capacity, leaving something behind after project is completed. If that is lacking, I don't think it's a good exercise to just come in, do one project, and go away without, ensuring that this research field can continue evolving locally.
Yeah, it's almost like saying it shouldn't be an extractive research, isn't it? So, yeah. Anything else to add to that, Masa?
No, I think that sums up most of everything that I was thinking as well.
Wonderful. I have a quick question. This is a follow-up to Dr. Smith. Point about finding other people. How do you build a community of others working in global research when it seems like it's all siloed here at the U?
Yeah, I can tell you exactly what you do. You attend Center for Global Health and Social Responsibility events and research. I have often joked that Shailey is not only a mentor, but my therapist. And it's just really true. I found that I work in a division that has really, really strong domestic research programs. And so inevitably, it just means that the day-to-day problems of the colleagues around me are just so distinct from what I'm dealing with, and it can feel very isolating. And then when I met Shailey, I was like, oh, someone who gets it, like someone who understands, which really felt good. And so every single person he's introduced me since is one of those folks. Uh, but when we are so siloed and we are such a big university, I have found it takes discipline to stay in touch with those people that he'll put you in touch with or that you meet. So every chance you have to like attend someone's talk, I think being on student committees with other colleagues is really helpful. Attending or participating in events like this, those are all really helpful for me and it kind of keeps me going. So I hope that's helpful.
Thank you, Kumi. Check is in the mail. Appreciate that. We have three questions and we are close to the end of time here. And I'm going to shape the question in a way that will be your final answer. From your perspective, as you have looked at all the questions that has come your way and looking at the green and red, orange flags, how do you navigate the pursuit of your own personal interest and make sure that the global health research is based on community-defined needs and it continues to advance equity? Because one of the refrains we hear about global health research is, it's somebody else's interest, somebody else's agenda. How do we then keep our individual scientific passion, scientific ideas, and still address the community needs part of it?
Yeah, I think I touched up on this earlier, saying that you do need search for a combination where you share research interests with your partners. But you also come to the table, open-minded and without assumptions that you know what exactly needs to be addressed.
Yeah.
And just listening and finding that common ground, which can be really exciting. It can expand your own horizons in what and how you do in your research direction.
Yeah. Thank you. Masa?
I think, I think we're, as researchers, ever evolving as well. One question leads to the next. And I think that you always have to kind of think about your next project and whether it's aligned with what is needed in the area that you're doing research. And then if you have a partner that is also as excited about the research as you are, who wants to partner up with you, making sure that it's mutually beneficial and that it's not like I'm coming here because this is my career and I want to advance in my career and I'm going to just pay you to do these research studies for me. I think those are less mutually beneficial and less likely to succeed or have very long lasting impact in the community. I think, again, for the work that we have been doing in Uganda, what has grown over the last, especially over the last 10 years, is that there are people within the group who are very interested in community participation, understanding the lived experiences of meningitis survivors. How could we, beyond the study, beyond the research, the clinical trial, how could we improve the lives of people even beyond that? So that's something, an exciting, turn, that our whole research team has taken as well, looking at more qualitative, more, community interactive, community organizing. So, and we're primarily clinical research site. So we do clinical, research. So, yeah.
Thank you for that. The last question, I'm going to answer it directly. How do we ensure long-term sustainability of partnership and projects? And the reason I'm going to answer it directly is that there is a growing interest in this. And we at the Center for Global Health and Social Responsibility have been part of the advocacy for global health partnerships that push the idea of long-term partnership as a key part of all global health activities. I would encourage you to visit our website to hear more about it. The key then is still, it is in the relationships. We need to build the relationships, not just fair weather partners. When the stress is the highest, we need to make sure that we are there standing with our partners. Thank you all for attending today's session. It's been a pleasure to have you folks. A survey will be sent to you. A post-event survey will be sent to your email. We strongly encourage you to complete it because we really look at your feedback for this. A link for, a recording of this will be posted on our website shortly. I hope you're able to attend other sessions in this Research Ethics Week at the University of Minnesota. Thank you all and have a wonderful day.